good.
All right, let's call the meeting to order. It's 10:04. First thing on the agenda is any public comment that needs to be made. Go ahead.
Daniel Davis, Eversource. I just wanted to, start off by addressing the Storm Elliott that we had Christmas Eve going into the Christmas Day. We are, our department, Tim Waldron here, my colleague, and our entire department are availing ourselves to come to our corresponding town to, address the storm events, areas that went well and areas that you feel Eversource can improve upon. We've already begun having some of those meetings, with our towns here in the COG. We just want to let you know that we are in the process of doing that. I'm sure you're all, well aware that it was a level 4 storm. We increased it from a level 5 to a level 4, which is good because with that we get additional resources and additional crews in state. But there were over 200,000 outages statewide, as I'm sure you're well aware. And in a level 4, our restoration process typically is 2 to 6 days to restore customers that lose power. Due to the sensitivity and the timing of the storm, it was incumbent upon the company to make sure that, of course, we got your constituents and our customers back online as quickly as possible. So just wanted to address that, and again, make you all aware that you're more than welcome to reach out to myself or Tim, your corresponding Eversource Community Relations Specialist, to hold an after action storm meeting to talk about areas of improvement and what you feel went well in the storm. So, thank you.
Thank you. Any other?
Sure, I would just echo Dan's comments. For the record, Tim Waldron, Community Relations for Eversource. Many of you know Dan and I basically split the county as far as our assignments. I won't reiterate what Dan said, but I will offer another comment. We are having bill assistance webinars for customers. You all should have received an email from us either earlier this week or late last week. We have 2 webinars scheduled. One is scheduled for this afternoon. Another one is scheduled for later this month. And we certainly encourage you to share that information with your residents, constituents, folks that might be calling your offices or your social services directors with that information. We have some good programs out there to support customers who might be in need and having some difficulty paying their bill. So we want to make sure that we can get the word out to those. And as Dan said, he and I are both available to you if you would like to chat. Give us a call or shoot us a text, and we're here for you.
Thank you. Any others?
You want to address this issue or we want to just let it go?
What?
We want to address this issue now or we want to let it go?
Let it go.
Let the individual towns vent privately.
Yeah.
Privately.
Okay.
Let's go on to the Narcan.
I appreciate you guys don't take it the wrong way.
The Narcan exercise. John Sonanelli. Come on.
Good morning. So actually, Sarah Toomey is going to give the Narcan presentation this morning, but I just wanted to tell you all about, as a reminder from last meeting, you all will be receiving opioid settlement dollars. And so we are proposing that those dollars be put into a fund that would be housed here at the Council of Governments. Leo has put together some language around that, a mission statement that you all requested that you could submit to your finance committees to make that process easy and smooth. I'm sure you have either distributed that, Leo, right, or you will distribute it later today.
Yes, we can email it out. It wasn't included in the package,
Yep.
but I can email it out.
Okay, so you'll all have that today. And we're also hopeful that after you receive the Narcan training today, which will be very short, 15 minutes, and then you'll know how to administer Narcan, that you'll think about different ways that we can engage your town members to get more of these trainings out into the community. So if after we do this today, you have thoughts about how we could do that in your towns or venues for that, please reach out to us. Those are free of charge. We can do those at any time. So please keep that in mind as well as you're listening to Sarah's presentation. Sarah is our lead community outreach and recovery navigator. So her and her team, the 4-person team, go out throughout Litchfield County and try to help folks who are struggling with addiction. We try to help those folks, engage them in treatment, keep them safe until they're ready for treatment. And the other part of their work is to really go out there and educate folks on addiction, and also things like Narcan. So I'll turn it over to her. And as soon as Rob's putting his Bill Gates hat on right now, we can get that presentation up.
Oh, sorry.
John, just the cost meeting, the Attorney General talked at length about what they're doing. So it sounds like there's more money coming still, because they're going after everybody they can. So what we receive right now might be a small percentage of the ultimate. So the idea of doing something collaboratively really makes sense, and I think every town is gonna continue to see money trickling in.
Yeah,
So that was encouraging.
yes.
He gave a good presentation yesterday, actually.
We already have brought it up to our Board of Finance. Our Board of Finance is on board.
Great.
I have some questions that I might pass on to you, because I'm getting personal emails from people saying that they're I have to sign up for something coming to my, not to my office email, but to my home email.
Okay,
I just wanted to converse with you about that.
okay, sure, absolutely, yeah.
That seemed a little odd.
Yeah.
That could be, there's some, they call it patient brokering, and there's these companies that have these websites, they want you to put it on their website. Those are scams, so. don't sign up for those things.
That's why I didn't respond.
Yeah.
And just a reminder that we will not be doing anything with those funds until we bring it back to this group. So this is just the first effort to get folks, to get towns to contribute to the fund, but then we will return to this group and talk about how we want to use those, right? So just put that on your radar too. And I'll turn it over to Sarah.
So John said, I'm Sarah Toomey. I'm the lead cardiac regional recovery navigator. I've had the pleasure of speaking with some of you either through email or various capacities. So go ahead and this is my information, and I have some cards. I'm happy to share it afterwards with you. Okay, so how did we get here? This opioid epidemic, it's been a large, part of our lives, kind of 3 waves, but now we're in this 4th wave. And so in 1999, there was prescribing. There was really little knowledge about what opiates were, how addictive they were. If you've seen the show Dope Sick, it really does a great job of describing what actually happened. There were lies and things that were told to prescribers. There were doctors that were just prescribing this stuff because they just wanted to help their patients. In the second wave, 2010, heroin, it became cheaper to buy. So when people got addicted to the opiate, they couldn't get it anymore, they turned to heroin. Then in 2013, we started seeing these synthetically made opiates, so like fentanyl, carfentanil, these other things. And so very much cheaper to buy, stronger, highly addictive. So now we're in this 4th wave that kind of started in 2020, and we're seeing lots of synthetic opiates. So the fentanyl, all these things that are being laced into everything, cocaine, pressed pills, whatever it is that's out in the street, any street purchased substance has the potential to be laced with fentanyl. Next. So what's happening in our county? So in Litchfield County, we see about 1 overdose a day. And so per capita, we have one of the highest rates of drug and alcohol use issues. And so it's when we look at individual towns, and I have a slide in a minute that's going to show what is actually happening in our community. When 1 overdose happens in a town that has only a few thousand people, it can really impact the community. Next. Back one more.
Oh, was back.
Yeah. So in 2021, we had 8 fatal overdoses in Litchfield County. 51 of those occurred in somebody's residence, in somebody's home. And so I really like to highlight that, because this issue, it's not a stereotypical person who is experiencing an overdose. It's not somebody who's homeless. It's not somebody who is maybe down, on their time of their luck. It's people who are like you, me, anybody else who is actually experiencing a substance use issue in their home. And so when we look at that, it makes it really challenging as an outreach worker to reach people that are in their home, because where do I go? If I'm coming out to Goshen, how do I meet with people? So it makes it really challenging. Next. So on this, I track all of the overdoses that happen in Litchfield County. And so this is 2022. We are still waiting on the final numbers for the medical examiner. So anything in yellow is a non-fatal overdose that's reported into a system by emergency services. And that goes into the system's called OD map. And then it gets tracked so that we can see where overdoses are occurring. And then anything in red is a fatal overdose that was reported by either EMS or the medical examiner. We should have that final report in probably March. They're behind a couple months. And so when we kind of look at the Route 8 corridor is really kind of prevalent in overdoses. But we kind of have an overdose in almost every town in Litchfield County. There's been a couple that have not, but so we see a lot of overdoses, of course, happening in Winston, Torrington, where there's larger communities. But like I said, smaller communities, like we look at North Canaan, small town, and so we are seeing a lot more fatal overdoses happening in those communities. So this helps us to target our outreach efforts. And so my team is really trying to focus on those underserved areas where we are seeing these overdoses occurring. Next. I'm gonna skip this. I think a lot of us know what signs of substance use is. And so we just kind of like want to make sure we're looking for changes of family members, friends, things like that. Next. So what are opioids? They are either prescription or street purchased medications, drugs. They activate the pleasure part of the brain and they relieve the intensity of pain. And I'm not just talking about like physical pain, ow, I have a hurt tooth or a broken leg, but emotional pain. I might not want to feel. I want to self-medicate or try to escape from my trauma, from my life, whatever's happening. They're chemically or synthetically made. They can include heroin, fentanyl, and carfentanil. And they're prescription pain relievers like oxycodone, morphine, Percocet, and anything like that. So probably I can accurately say that most people in this room have probably been prescribed an opiate at some point in their life, whether it have been for a wisdom teeth extraction or a broken bone. On average, it takes about 5 to 7 days to get addicted to an opiate. And so when we were getting prescriptions for 30 days with 3 refills, people were getting addicted and then they didn't really know where to turn. Next. These are some examples of opioids, and they can include, anything from heroin to Oxycontin or Vicodin. Next. So counterfeit substances in our youth, this is the scary part, and where we are trying to do more work with prevention, our schools, because Xanax, Adderall, you don't think of things like Adderall. That could, if it's not prescribed by your doctor, you shouldn't obviously take it. But kids we know are going to experiment. So taking something like an Adderall could be laced with fentanyl. And then these substances are sending more youth to the emergency room with symptoms of overdose or side effects from the medication. These medications and things are very, very strong and potent, and their little bodies can't handle it. So not like an adult. And so they're experiencing more issues, even more so than adults. And because it's not an overdose, it might not be reported. So we don't really have a good kind of idea of what that actually looks like. 8% of fatal overdoses in 2020 were under age 25. When I first started, if you asked me what age group demographic of people who were overdosing were, it was probably a white male from age 40 to 55. That was our demographic. We're seeing a younger population of people, more women, more youth. And so it's kind of changing the demographic. Next. Apologize, I'm moving a little fast, but I just want to get through the presentation. So I'm happy to answer questions at the end. These are some pictures of some laced substances. So as you can see, real and fake pills, these kind of medications were put in front of pharmacists who dispense these medications every single day, and they could not tell the difference. And so people are taking these medications, crushing them up, kind of distributing them with other things, and then repressing them with pill presses. So you can't tell the difference. We had our first case in Plymouth, Connecticut of fentanyl laced marijuana. And so again, we think of that as, in the big scheme of things, a safer substance. Marijuana isn't safe. And so we want to encourage people to use things like fentanyl test strips. And if you don't get it from a pharmacy, it probably contains fentanyl. Next. So overprescribing of pain relievers, unused medications that are kept in people's homes, people that might take that medication, steal it, a lack of understanding of what the actual issues are with prescribed opiates. And then when it becomes problematic or expensive, people turn to other things like heroin or street purchase substances. Next. This is a comparison of heroin to fentanyl to carfentanil in the amount that it actually takes to cause a fatal overdose. So if you look at think about heroin, and we don't see heroin anymore, there's no heroin anymore. It's all fentanyl and other things. And so the amount that it actually takes is very, very small. And so if somebody is taking a substance, it's just that powerful and potent that it's going to cause an overdose and potentially fatal overdose. Next. This is just a kind of change of what we're seeing in the substances. So in 2016, we were seeing heroin and things out on the street. Fentanyl has increased from 53% in 2016 to 85% in 2020. Cocaine, we're seeing a lot more cocaine being laced with fentanyl. And then xylazine, which is a horse tranquilizer or animal tranquilizer that comes from Puerto Rico. We are seeing that significantly increasing in our supply. It is not an opiate, and so Narcan is not necessarily effective, but it's typically mixed with other things like fentanyl. And so we expect that number. So in 2020, it was 10% of the fatal overdoses had xylazine. I expect that number to be about 40, maybe even higher percentage this year. And so it's really suppresses the respiratory system. So rescue breathing and CPR is extremely important. Next. So who's at risk? Everybody, anybody who uses any street purchase substance. But our children, teenagers are more susceptible and at risk. Seniors who are prescribed multiple medications, they might forget they took it and take it again. People with chronic pain, they built up a tolerance, and so they need to take more and more. People that are on Medicaid are typically prescribed more opiates. Young adults, 18 to 25, tend to use at a higher rate. People with suicidal tendencies, and then people who have been in a program, detox, jail stay, they get out, maybe they haven't used in a while, the drug supply has extremely changed, or they try using what they used before, and they're more susceptible to an overdose. Next. So naloxone or Narcan, it's the same thing, but you'll hear people referring to Narcan or naloxone. It's a medication that counters the effect of an opioid overdose. So ultimately it reverses an opioid overdose. It is extremely safe. If a child got their hands on it and decided to put it up their nose and squirt it, it has zero effect unless the person has an opiate in their system. So when people say, I don't want to have that in my house, my child might get their hands on it, it's going to do absolutely nothing. It's extremely safe. No potential for abuse. If somebody can't take it and it's going to give them any kind of high, it does the complete opposite. It takes away that high. Next. So when somebody's overdosing, the opiate is actually attacking the receptors on the brain that allow people to breathe. And so when it's attacking that brain receptor, and then we introduce Narcan, we're going to kick that opioid off that brain receptor and allow the person to start breathing again. So it only works on opiates. It's like heroin, fentanyl, carfentanil. It won't work on things like straight Xanax, straight benzodiazepines, but if it's laced with an opiate, fentanyl, then it would work. So it can be a little confusing, but if we don't know, if we're not sure what happened, we just walking down the street and we come across somebody who's passed out on the ground, they're not breathing, we can give Narcan. The worst case scenario is just going to do nothing. Okay, next. So this is a description of that opiate on the brain receptor. And so then when we introduce the Narcan, it kicks it off and it hopefully allows the person to start breathing again. Next. I'm gonna skip this one. We're almost out of time. So first thing is recognizing the person's overdosing. They might be turning blue, gurgling, gasping for air. They're not breathing effectively. So you want to then call 911, of course, administer the Narcan. I'm going to pass these around. This is a training device, so it's a fake device. And this is what the Narcan actually looks like. So you can just kind of see, pass those around. You can see those. So you want to monitor a person's breathing. If you know CPR, rescue breathing, perform that. And then put the person into the recovery position. People are very likely to vomit after an overdose. So we don't want them to choke, aspirate, and then we have a choking person on our hands as well. Next. So identifying the overdose, so turning blue, gurgling, pupils might be teeny tiny. They're not moving. You can do the sternal rub. That hurts if you do it to yourself. You can feel it. So if somebody's going to wake up, that's going to do it. And so they can't move, speak, and they are probably not breathing. Next. Tap, shout, call their name. Are you okay? No response, of course, call 911. Next. So administering the Narcan, we're going to remove it from that package. The Narcan kit looks like this. And so there's 2 of the nasal Narcan devices in each box. So we're going to open the person's airway, put that nozzle into the nose as far as it goes, and it's just quick spray. There's 1 dose in each one of those devices. So we give that dose. We're going to wait 2 to 3 minutes. It's really important to wait that 2 to 3 minutes because it needs to work. It needs to collect all those little opioids off those brain receptors. If the person doesn't wake up after 2 to 3 minutes, we can give a second dose in the other nostril. Okay. People could need multiple doses of Narcan before they wake up. So we can keep giving 2 to 3 doses, or giving doses every 2 to 3 minutes. Next. And then the recovery position, putting the person on their side. We don't want them to then choke and aspirate. Next. And then people might be dazed, confused. They're likely to vomit. They are going to be put into withdrawal. They're not going to feel well. So it's important to make sure that you don't let them use again. Now they're in withdrawal. They are probably going to want to take away that yucky feeling that they're going to have. And so they're going to want to use. It's really important they go to the hospital though, because there's not only getting medical care, like people like myself that are embedded into the emergency rooms that help get people treatment. People can re-overdose after a certain amount of time, about 30 to 45 minutes, because the Narcan wears off and the opioid takes over again. So people can experience a second overdose. So we never want somebody to go sleep it off, because then they could have another overdose and they're alone and they can potentially die. Next. These are some devices that are out there. The top device is 3 pieces that you have to screw all together. Very difficult to use in an emergency when you're panicking. We don't see those a lot anymore. The bottom left is an auto injector. That device actually talks to you. Very expensive, but it's like an EpiPen that you can inject into the muscle. Middle is the Narcan that we are seeing more. And these are the ones we give out. We've given out over probably close to 2,500 Narcan kits across Litchfield County in about 2.5 years. And then we have injectable version that you drop into a syringe and can put into a large muscle. Next. They're changing the storage and expiration. Narcan is good way past the expiration date that's on the boxes. These kits are good until 2025, but if you have an expired Narcan kit, use it. It's going to do something. Some Narcan is better than no Narcan. It's not recommended that it's in extreme temperatures. It could lessen the effect of the Narcan. They're not really sure. They're doing a lot of testing on it. But like I said, if that's all you have, use it. It's going to do something. And so not in a refrigerator, not in direct sunlight. Next. You're covered under the Good Samaritan law, as long as you act within the scope of your training and act within good faith. So you don't have to worry about somebody saying, you saved my life, I'm going to sue you. You're covered under the Good Samaritan law. Next. And then these are some resources. We work very closely with the Litchfield County Opiate Task Force. We have Narcan distribution sites all across Litchfield County. We have 16 that we're operating from Kenton, Canaan to Winston, Barkhamsted to Thomaston, Watertown area. And we're adding a couple additional ones to try to target those areas where we're seeing more overdoses. And so we're always kind of looking for new ways to reach out to the community and get Narcan out to people. And I believe that's my last slide. Sorry, that was quick and fast and furious, but happy to answer any questions or leave my cards.
I have a question.
Yeah.
I'm sorry. This is Eleanor Carbone. Could you possibly go back to the screen where you showed the overdoses, the fatal and the non-fatal overdoses? I'm looking at the number that's reported for the city of Torrington. And actually, I guess the smaller towns there, the numbers were closer to just one per community. But the question I have is, of the I think it was 72 non-fatal overdoses that were shown on that for the city. Are any of those? Yeah, 72. Are those repeat? Is it like the same people that continue to have overdoses? Or are these 72 unique cases of overdose? I can't hear.
Oh, maybe if I get, where's the speaker? That's
It's right here.
They can-
Can you hear me there?
I can hear you. Yeah.
I'll come closer.
I couldn't hear the response.
So they are 72 unique cases, like
Wow.
individual, but it could be a person that had a different case. So we don't have the information that says who the person actually is that overdosed. I could ask Torrington Area Health District if they could potentially look at that information to see like how many cases were people who have experienced an overdose in the past. We did get some information recently that about 80% of overdoses that are occurring are people who have never experienced an overdose before ever. So it's a lot of individual unique people. We are typically seeing people that are overdosing as somebody who tried it for the first time. And it's not our regular people that are overdosing. People who I see in the community all the time are not who is overdosing. It's people who, like I said, have never used or returned to use after a long time.
Yeah, I'm just, when I look at these numbers, I'm thinking, what is our strategy for reducing that? And I mean, obviously Narcan is the life-saving godsend of a prescription or a application, but solving the root of the problem is really where we need to be. But thank you. I appreciate this report and appreciate the commitment to helping all of us understand the value in getting trained in Narcan dispensation. So.
Thank you. And I'm happy to share this information. I could send it. I put together some reporting, and then in probably March or April, we are, I'm going to work with Torrington Area Health District and putting together a detailed report. And so I could bring, if you have suggestions or you have specific questions, please.
Burlington has a question.
Oh,
Burlington has a question. John? Yeah, Burlington?
Yes, good morning. I'll get my camera here. Yeah, just I don't see Burlington on there, and I know we're not in the Litchfield area. Obviously, we're in Harford County, but as we talk about the opioid settlements, my concern obviously is that it's going to go to the resources that'll serve Burlington, and I'm also curious as to the overdose numbers for the town of Burlington.
I could get those for you. I know the Burlington Health District, Burlington Bristol has an opioid grant that they receive. It's very similar to the grant that we have through DEMAS. And so we have worked with them in kind of collaborating when we have people who are right on the Litchfield County line. But I can certainly get those numbers for you so that you have them, I have access to the entire state.
Thank you.
I had one question.
Yeah.
Since many of us are in public meetings, public hearings, things of that nature with, any number of, residents and whatnot, how do you really, is it hard to understand who might be having an issue like this as opposed to like an epileptic seizure or something other, some other health event? Or,
Yeah.
we saw that in the NFL recently, not that that's gonna happen in that public meeting, I hope. But, how do you differentiate
Yeah.
and when to use it?
Yep, so if you're not sure, use it. But I think typically, so somebody who is experiencing an overdose could be, they're not breathing, but they could have a pulse. And I think that is kind of the biggest difference. So somebody who's having a heart attack, their heart's not working, they're not gonna necessarily have a pulse. But so somebody who is overdosing, the respiratory system is what is affected the most. And so somebody who is not breathing, we recommend administering Narcan.
Okay.
I think the message though should be that, if you don't know, administer, because it's not gonna interfere with any other life-saving activity. So if the person ends up, they're having a heart attack, they're not overdosing, it's not gonna interfere with anything EMS would do to save that person's life. So it's not gonna hurt them at all. So if you're in doubt at all, give them the Narcan.
So one of the takeaways could be, we all want to have an AED in our public spaces. Maybe we should have something like that too.
Absolutely.
We encourage people to actually put it in your first aid kit or AED box. We are happy to provide it. We give it out all the time. I actually brought some with me, so if anybody wanted to take a Narcan kit with them, I have a few of them. Maybe I can leave them with Leah.
Sure.
And then I'm happy we deliver all across Litchfield County. And so we're happy to drop them off, train your entire town hall, train your staff. Anybody who will listen to my mouth, I'm happy to speak with.
Yes, I have a quick question. So the mayor of Waterbury brought this up, that a lot of our small towns, the people that live here actually go to the bigger cities to get their drugs. So for example, Torrington, is that the people who actually live there, or is that people that had an OD situation there? No, is it differentiated?
I've looked at the fatal overdoses and where they're occurring. That's the report that we get the most information from. And when I look at who is actually experiencing the fatal overdose, probably about high 90s%, 95% are people who live in Litchfield County. There's only a very small percent of people who live in other places. And again, we don't have we get very, very little information because of HIPAA, so
I'm just wondering if the Torrington numbers are a little skewed for Torrington, because some of our residents are going to Torrington.
Yeah.
Maybe they're getting the number attached to their team, but maybe they're some of our residents.
Yeah, I could certainly ask Torrington Area Health if they can provide some of that information.
Yeah, Denise, I think to answer your specific question, the data that gets reported by EMS up to the poison control sword people for the OD map is where the overdose happens versus what their home address is. So yes, there likely are overdoses that are happening in an urban center that maybe those people, that's not their home address. That was one of the sort of pinch points when DPH was developing the program.
I think I just want to highlight, you had mentioned social media was a way that the younger users are getting their hands on things like this. And I think that's just important to highlight, because you think about all the different social media platforms that people have to communicate on. And it's easy for, I guess, call them predators, if you will, the drug dealers, that they can reach out to younger kids online on social media platforms and say, hey, I got this stuff if you're looking for it, so I think it's not always like in person that they're making this connection, but it's also online.
Yeah, they mail it to their house.
Which is frightening.
We have a couple of comment and question, I believe. So David Lukens, who's actually going to be presenting in a little bit, he mentioned that DPH also publishes some of this data in interactive maps. I'm not sure what data it was referring to at the time, because that was a few minutes ago. Maggie Winslow from Heartland has a question. Is there a number where we can call to schedule training and receive kits?
Yes, so I can, there's a slide that I have my contact information, but I can share that out again.
I can share, yeah, I can share your presentation out with.
That'd be
membership.
wonderful. So yeah,
Has that
please
information.
contact me. I'm happy to, I could do them virtual, in person, whatever works.
Okay, and then Julie Scharnberg said the ME's records will show town of residence as well as the location of where that person OD'd.
Yes, yeah, so we only have that information for fatal overdoses, not the non-fatal.
And always remember that if, you know, you lose my number, Sarah's number, whatever, just call Greenwoods directly, and we can always, you can always get connected that way.
Thank you so much.
Thank you. Okay, Rob, you're next in line.
Yeah, well, I'll be very quick since we're always seem to be short on time, no matter what happens, but NHCOG office situation update. We had an executive committee meeting this morning and essentially it was decided that with the number of issues we've had, looking at some of the options that are available to us, we decided to basically move forward and monitor the market and not do anything drastic right now as far as staying here and expanding or going to any other location that we looked at, like Field Street or the glass building in Torrington. I don't know if anybody has any questions about that or if any of the executive committee members want to follow up on anything there, but that's generally the position we're at.
That you're not gonna move.
Well, we're gonna stay and monitor and see what else may be out there, as time moves along here. There just, nothing seems to be the right fit, not just now, but in the future, 10 years down the road. Yeah, there's a lot of detail behind that, but that's kind of the general.
Rob's being kind. Once again, he doesn't want to say publicly, which probably needs to be said, is that the people that are the property agents for these are a little bit more difficult to work with and not making things easier. The value of having the COG as a tenant in their particular spaces that we looked at, so. You know, so for the time being, till that works out, maybe we just stand down. And if Rob finds something good for us, we'll consider it.
Yeah, we're ready to jump, but not at what we've seen so far.
Yeah, so we may look at, and again, if anybody has anything, any ideas. Yeah, obviously, we're preferring the Torrington, the area kind of still central to the region, but maybe a little bit more to the east. Maybe the Torrington area is nice because it is kind of the central cog, so to speak, of the region. But you know, even if it's a potential purchase and build, that may be an option as well too. So, yeah, we welcome all leads. And the other thing I wanted to mention in your package, you'll see, I just want to summarize a little bit of what the primary responsibilities are for staff as we've been slowly kind of working through our onboarding process over time. Nothing can happen overnight, as you know. And we've kind of settled on some of the major responsibilities for staff. And certainly the way that the COG is kind of structured at this point in time is we're all working on a little bit of the same thing so that we're all in the know. And if somebody's not available, at least somebody might have some information or be able to assist you if the person, if one of the people that you were normally worked with wasn't available. So it's a little bit of redundancy there. I've always been a big fan of that personally. I think it's worked well in the past. So, you know, and again, it's in the package. I don't want to belabor the point, but, you know, Emily is obviously working on most of the economic development work, the Fifth Thursday events, land use administration, basically the planning and zoning type of arm along with economic development, conservation, natural hazard mitigation, the regional POCD, and then also the regional council or regional housing council liaison as well too. So that's a little bit of what Emily is working on, so that you know if you have questions or concerns that go in that direction first. Catherine Faraci is working on our basically all our transportation type work, the RITS program, the TRIP program that's rolling out now, the LOTSIP program, and management of the regional engineers, highway safety, transit, anything associated with transportation. Casey would be the first person you'd want to reach out to. Sarah obviously is working on most of the things that kind of keep the home office going here, including all the accounts payable, receivable, including the Demis accounts payable and receivables and other financial management. The social service programs that we have, the prescription assistance and things like that, that's going through Sarah as well. You went through Darlene previously. And any other support services. And as far as I'm concerned, I kind of work with everything, obviously, and that's kind of how we're moving forward right now. There are some areas that we're trying to strengthen. Maybe some of our financial side of things, bookkeeping, we could use some more help there to try to make sure that we're reconciling and we're doing that work appropriately. GIS needs, I know some of you have reached out to us. We all had various experience with GIS over the years, but the problem with GIS is you have to use it continuously. You have to be engaged in it in order to be really effective and be able to deliver, have deliverables that you're looking for. We can't just dabble in it once or twice or 3 times a month. So we're trying to figure out a resolution right now, how we can, we may actually work with Capital Region Council of Governments, for example, and maybe have some little bit of shared services from one COG to another, to try and see if we can accommodate the GIS needs that we have. There's so much more we can do with GIS. We really could be your go-to as far as your GIS needs in the future. I can envision that. But right now we just don't have the bandwidth to really take that on. So that's one example of where we'd like to grow a little bit. And that's kind of just a real quick overview. We can talk about anything else outside of this, but I want to just keep moving on that. But I just want to give you a kind of a take-home sheet. It kind of says, okay, this is the kind of area, this type of thing, I should reach out to so-and-so. So that's that. The third item, I just wanted to talk about really quick, workplace diversity and harassment training needs. Obviously, we all need to go through that periodically. We as the COG are due. I don't know if anybody else is due or if anybody else is providing that type of training right now that we could maybe collaborate, or if we should as a COG hold something that you all can send some of your staff to.
Our insurance carrier Kerma provides this type of training, so you can probably use that.
Just go with Kerma and talk to them, and that's how you're all doing it.
So we've done it. They come to our town hall, or we've had it at the firehouse, and we have a large group of people.
All right, so you're meeting your needs. You don't have necessarily.
We are.
We have 3 or 4 coming up for renewals, because
Okay.
we do it annually with all the staff, because we get new staff in and out all the time.
Yeah.
And it's good to keep your certifications up.
Right.
So if you want, I can have Jen in my office send you a list of when our trainings are, and you can just join in on ours.
That'd be great. Yeah, if anybody else has a need there, let us know and we'll try and see if we can coordinate, facilitate something if we need to. So that's really it.
So let's go on to Emily.
Okay, sure. We wanted to just mention that, and we'll hear a little bit more from David Lukens, but actually a lot more, he'll give us information on broadband mapping in the state. But we wanted to note that the 2022 Connecticut Broadband Report was released. So if anybody's interested in taking a look at this, the very high level takeaways regarding funding are that there's a timeline provided in here for the funds that came from ARPA. That was about 43 million to the state. It provides a timeline for when funds might be released. An RFP is supposed to be released this quarter, 2023, Q1, for funding applications for the state money that came in from ARPA. And then the money that's coming from the BEAD program, which is the Bipartisan Infrastructure Law program, that money will be dispersed a little bit later. An RFI was done over the summer, and the state is still kind of trying to gather information on how to best structure that program when the funds come into the state. So initial funding for that program really won't be available until 2024. And then there'll be some more funding following up in 2025. So if anybody's looking for, immediate broadband monies, that state money from ARPA is the first pot coming up. But anyway, there's some schedules provided in here. There's a lot more information about, what they've been thinking in terms of developing these programs. But since we're going to hear about broadband and the mapping from David, I will not go too much more in detail on that, but that report is available on DEEP's website. just the Regional Housing Council, just wanted to touch briefly on this. You probably may all recall, but in March of 2022, this board had approved a small set of bulleted lists on how the COG would be participating in Regional Housing Council going forward. Right now, it's operated under the Litchfield Center for Housing Opportunity, which Jocelyn Ayers is the director of that. So just wanted to reiterate how we're kind of participating with that group. And it really comes back to what was agreed upon previously, but just to review, the center will hopefully provide some updates to us going forward. We had agreed to 2 a year, so hopefully we'll have Jocelyn come in and give us an update sometime in the near future here in this first part of 2023, and then again sometime this year. We're going to be using the 5th Thursday events that you may all know about. Those were traditionally for land use commissioners and any of your land use administrators or staff to have training opportunities. Hopefully, we're going to use those this year to fulfill the training requirement that has been required through state law now. But one of those 5th Thursdays, this first one coming up in March, is going to be on housing. So we'll have Jocelyn and her staff probably come and do a training on affordable housing at that. We will continue to sit on or participate in the Regional Housing Council meetings, and then, consider other opportunities for partnership. But I just wanted to bring that back to you to let you know that housing council under state law, it doesn't have to exist within the COG. And right now, it doesn't, but we are a strong partner of that. So
And just real quick, the affordable housing coming for the 5th Thursday, I think that's one of the specific focus areas that are required in the state law change.
yes, I believe 4 hours of training are required in the period of a year for land use commissioners now. And the training, can be on, really, there isn't any guidance on what the training can be on, except that one of those hours has to be dedicated to affordable housing. So we will utilize the center and the housing council to do that. So that was that update. And then the SEDS, I just wanted to mention that we are moving along with our SEDS update. We are going to be having an EDC executive committee meeting next Tuesday on the 16th. And that will be to hopefully organize us a little bit more toward launching our first phase of the update. We're also using some of the money in the first.
Next Tuesday, the 17th.
17th, oh, I'm sorry. I have the 16th in my mind because it's the holiday. It's the 17th. And that's at 1 o'clock, but it's the executive committee, not the larger EDC. Hopefully that's gonna organize us a little bit more. We're gonna use some of the money from the first year of the grant to do some data collection with a consultant. But we're really gonna hit the ground running with a little bit more consulting help, I think, as June comes along and we get our second round of funds for the 3-year period. So that was one quick final note. It's actually not on the agenda, but if it's okay, I'm just going to mention there was a deep recreational trails grant webinar yesterday on the upcoming grant opportunity. And that grant, I believe it's due, it's either late February, early March. We're happy to talk with you about any applications you might be wanting to put in, and obviously provide support letters for that. But if anybody wants access to that webinar that happened yesterday, we can try to get that for you too.
I have an engineered plan that I've looked
Is that
looking
video
for
available?
referral.
Okay.
But I don't think the first day.
And was that video available?
Later, is it the 20th?
Is the video of the webinar available?
It likely, and so we'll find that for you. We can send that out through the, we were at the cost meeting, so I didn't participate, but we can.
So, what Dan was.
Right.
Yes.
Okay, so we'll try to get that for you, so hopefully that'll have some more information. Maybe it's late March 23rd or something.
I think it's the
Okay.
3rd of March,
Okay, 23rd of March. I have my date there. Just one.
but it's a construction, it's not a planning grant, it's a construction grant, which we just came off the planning grant, so we actually have the results in an engineered plan ready. So it'd be hopeful that the COG would consider a referral.
Yeah, absolutely. So. Okay.
Okay, it's time for David Lukens.
Hi there. Can everybody hear me? Okay. I saw mouths move that sound like they can hear me, but I could not hear you. So I'm just going to assume that's a yes.
Yeah, we can hear you.
Okay, all right. And I'll go ahead and share my screen. So I'm David Lukens. I am the broadband mapping coordinator at the Office of Policy and Management. I also brought Kevin Pasasic from Deep. He's the money guy, so I can't really speak to some of those things that he can. And I just want to give a quick overview of where the state's at, how it relates to federal processes for mapping and, you know, planning all this broadband money, where it's going to go. Give you a brief overview of our results after we've done our own internal mapping. And most importantly, share with you the resources that we have at the state so that you can, you know, I'm happy to explain anything that I can, but we do have a publicly available data portal that you can go find this data on, compare it, and, you know, try and see where your problem spots are that you might not know of, or tell us when we are wrong and we're missing something importantly. I have some notes on how we can cooperate in the future, and I'd really like to encourage that. And then Kevin will talk a little bit more in detail about funding programs and the like. So just to give you a sense of, you know, what we've been doing, after starting in the beginning of last year, we worked on a data request with ISPs and collected all of their service data in April. From May to July, we worked on improving the state's location fabric. For what it's worth, the state of Connecticut's E911 database had about 950,000 unique locations early last year. It now has 1.4 million. So one of the biggest challenges for us at the state and for the FCC isn't just where there is service, but where there should be service. So that's something that's going to be a continuing issue, and we want to make sure that there's communication between localities and the state so that when we know that, okay, we didn't know there were houses there, please let us know. Anyway, in about August, we finished our first draft availability map and went through another round of data collection with the ISPs. This was really important to make sure that we both had up-to-date data, but also to see how the FCC process had changed their results. Because as the ISPs had prepared their data for the FCC's data collection process, in many cases, it skewed the results. In some cases, providers suddenly dropped 200,000 residences that they actually provide service to. And in other cases, places they don't provide service to were added. We were able to cooperate with the providers and get most of that cleaned up. But it's an ongoing thing. So since November, our availability and adoption maps have been live online, and I'll show those to you in a minute. And the FCC maps have also been published. So we finished that report up in 2022 that Emily mentioned, and we've also been in an ongoing process of challenging the FCC maps, which I also want to talk to you about how you might be able to help and how we can cooperate on that. So just real quickly, the map on the left here is if you take the FCC's old data. So before we did our initial mapping process, this is what the FCC would have shown in terms of where areas are unserved. And as you can see, a lot of the changes in the map on the right are in Northwest Hills COG. So Litchfield County and its surrounding areas are areas that are overrepresented in terms of unserved areas versus population. And of the 7,000 or 8,000 unserved locations in the state, and of course, we're always trying to fix that number. That's just where we're at now. Around 1,500 of them are in the Northwest Hills COG. So it's an area that we have to pay a lot of attention to. And we also know that our data on, for example, locations in the Northwest Hills is the worst of all of our data. It's something that we're working on, but even when we compare with the FCC maps, there's a lot of places that, according to our records, is vacant. The FCC thinks it's real. It's very hard to sort of ground truth these things. Like I can't just go for a drive every time. So we're trying to use updated parcel data and the like. So for what it's worth, when GIS was being discussed earlier, if there's any way that we at the state can lend the resources of the GIS office to help with COGS upgrading their GIS capacity or even helping with smaller tasks, we are super interested in doing that because that can help us in our tasks as well. So please stay in touch with us. Let us know if we can help on that kind of thing. So again, just overall availability in the state is actually pretty good. We do have these concentrated areas that are primarily the more rural areas and areas with a lot of like long driveways, private roads. Those are the areas that we really see a lot of concentrated unserved areas. What we also are seeing is a rapid expansion of high-speed like fiber connections. So the state goal is 1 gig by 100. And just since December of 2021 to September of 2022, we're seeing a rapid expansion of those high-speed services. But again, in areas like the northwest corner and the northeast corner, we're seeing those services being rolled out much more slowly. And so that's not always the kind of thing that federal funds will support, but we also want to work with everyone to make sure that we are reaching that goal and try and support localities in that goal as well. Similarly, on adoption, we see the northwest corner as being of particular interest and as an area that is low on adoption, but not necessarily because of economic reasons. It is more because of availability. An important note here is although the state as a whole is about 86.7% subscribed to internet, this number only includes fixed terrestrial broadband. So that means like a wire coming to your house. And so one of the reasons the Northwest Hills looks a little bit less subscribed than it probably actually is because we are not getting subscription data from satellite companies. I'm working on it, but they don't fall under the public act that allowed us to collect data in the same way. So it's sort of we just got to hope that they want to help. So the biggest thing that I want to show you all today is the Connecticut Broadband Mapping Hub. And can you see that I switched to a website? I just want to make sure I'm still on the same screen.
Yes, we can.
Okay, all right. So this is the Connecticut Broadband Mapping Hub. You should be able to, through this website, find all of the data that goes into these maps, except for the address level data. Because of the statutory basis to our data collection being PA 21-159, we cannot share the address level data without a special data sharing agreement. So what you'll find here is this data at the block level. So when you're zoomed out, for example, this is availability. This is going to show you by town. You can click on any town and it'll give you the number of locations that we're counting, the percent of those locations that don't have 25.3, and then the percent that meet 1 gig by 100, as well as what providers are available there. Then as we zoom in, it switches to the block level, and you can again go in and click on any individual block, and it'll give you details on how many locations we have there. It's going nice and slow just because I'm doing a presentation, but it'll give you data on how many locations. So in this part of Sharon, for example, we have 7 locations and 85% of them do not have service. So 6, right? The areas that are sort of hatched with like the checks across them, those are areas where we don't have sufficient locations. So maybe there are no locations or there's just one, so it's hard to say for sure. Those are still included in our counts, but if we put them on the map, it distorts things. So that's that basic resource. You can look at all those things on the Broadband Mapping Hub, but you can also go to the data library and get that availability data by block, download it in a CSV or an Excel file. You can export it to another geospatial format if you want to put it in Google Earth or anything like that. And so all of these resources are here. Importantly, in the event that we are wrong, which I'm sure we are somewhere, you can come here and tell us about your internet connection. We click this, it's a little less than a minute survey. Just give us your location, tell us what the problem is. Even if you have internet, but the connection is slower than it's supposed to be or anything like that, you can put that information here. So it'd be really great if you can share this kind of thing with your constituents so that we can get as many people interacting with this as possible in hopes of, creating better data. So I don't want to take too much time. So I just want to then show the FCC National Broadband Map is this website. It is not super intuitive. People might say the same about my map, so I don't want to be too I don't want to be too critical, but a really important, oh dear. A really important thing about when you go to look at this map is that you can directly challenge any data in this map with the FCC. Those numbers, we are also doing that. So we're going to make sure that this is all right either way. But what the FCC has will relate directly to how they allow us to determine project areas. So as much as it is possible, it's really good for residents, local governments to be going on this website and making sure that things appear correctly. Now, one of the biggest things, and I just want, this is the only thing I'm going to show here, is when you go here, you have to click on this settings gear and go to terrestrial, or otherwise the whole state is covered by satellite and you will not be able to discover anything. But if we take that off and we zoom in, we can find individual locations. Again, going so fast. We can find individual locations in places like Cornwall Bridge, where, you know, in this little hex, there's only 48% coverage. I stayed at a campsite near here. I know this area. And you can find these individual locations that show as unserved. You can click on it. Well, you can click on it. You can click on the individual locations and then you can actually say, hey, I don't have service. And so this is already, I've already talked with some representatives of Sharon Connect about this. Sharon is trying to connect a number of homes with Comcast, and those homes that are to be connected already show as served, whereas a number of the places where people can get DSL, that's not represented in the map at all. So we are actively working on those larger issues, but there is this portal that people can use directly and make sure that their home is correct. And that's going to go a long way to making sure that everything we do is as accurate as possible. So if your residents would prefer to show me on my website and answer my little survey, I'll take it. I will send it to the FCC. If it's easier for them to find their home on the FCC's website, they can go and do directly that. We want to have these things going from as many directions as possible to make sure that we're as accurate as possible. And so I really want to be able to cooperate with everyone on the FCC challenges. If anybody has any questions about this, feel free to let me know after the talk or send me an email. I can try and give you additional information. And the other thing I'd really like to talk to everyone about real quickly is the potential for cooperating on community anchor institutions. So one of the areas that Kevin will no doubt tell you about that BEAD can fund is community anchor institutions, but it has a really broad definition that is anywhere really, a community support organization that facilitates the use of broadband. And so I've created this really simple survey. This is just a sample because I want to get some feedback on what would be easiest for COGs and localities to use. But the more places, if a church helps people write resumes on their computer, that could count. If a local nonprofit helps people get connected to their computer or provides technical assistance, that might count as a CAI, and we can help fund digital equity programs there. And we might even be able to connect some of those locations. So having better data about community anchor institutions is really important. And I'll send both of these links in the chat so that people can check them out and give me some feedback. But I want to give Kevin a little bit of time to actually talk about the funding. So that's my bit. I'll pass it over to Kevin.
Thanks, David. And I'll try and be as quick as possible. I'm assuming this meeting officially ends at 11, so we're over time. Is that correct?
We run till noon.
Okay. I'll be as quick as I can here. All right. So Kevin Pasas is Director of the Office of Telecommunications and Broadband within DEEP's Bureau of Energy and Technology Policy. We have the good fortune of administering 2 of the federal broadband programs. And let me reiterate, and Emily, thank you for mentioning the 2022 broadband report. I did put that into the chat. That was DEEP was required to develop that report. We'll issue it once every 2 years per the Broadband Act. So that has a lot more information than I'll hit here for the sake of time. Let me also say too that If you need a deeper dive on any of this, feel free to reach out to me and we'll happy to give you what you need. So the first of the programs is a American Rescue Plan Capital Project Fund based program. That is almost $43 million. It is going to be a broadband infrastructure grant program with two areas of focus. The first is underserved area infrastructure grants. That's locations and areas lacking access to 100 down by 20 up. And the second is a curb to home or curb to building or line extension component, especially in distressed municipalities for multi-dwelling units. And the objective was straight out of the bill text as passed in 2022. So you can see on the right-hand side, some of the parameters of this program. It will be a competitive grant program. We're rating a request for proposals, application process, and applications will be scored according to the program parameters. There will likely be a match component here that hasn't been finalized as to what that amount will be. Some of the priorities of this program, I'll just hit here very briefly. There is a prioritization for fiber optic infrastructure to be able to get to that statewide goal of 1 gig by 1 gig down by 100 up. We need to deploy at least 100 by 100 per Treasury statutes under this program. And then there was also an encouragement to allow alternate service provider arrangements. That would be municipal governments, cooperatives, et cetera, those beyond just your traditional incumbent broadband service providers. So key dates on this one. We are hoping to release this this quarter. Actually, David, I might have just lost the slide there. If you could go back to it. Yeah. Thank you. So yeah, in our report, we did say we're shooting for first quarter. That's an estimated date. We're still hoping to meet it. If not this quarter, it'll be next. We're still marshaling resources within the state. There's been some delays in that, and Treasury will need to approve our final program guidance and so on. And Treasury has been a bit delayed on their process. So we're still hoping to meet the deadline, but we will do the best we can. Certainly, we expect to release by middle of the year. So let's go to the next slide, David, if we could. The second one is the Broadband Equity Access and Deployment, or BEAD program. This is part of the EJA, or Infrastructure Investment and Jobs Act bill. And this allocates at least $100 million to every U.S. state, and some territories get a bit less than that. There's a total pot of $42.5 billion, and the remainder of the money after initial allocation will be allocated based on the state's percentage of unserved locations, which is those lacking access to 25.3 in high cost areas and in proportion to locations in the rest of the country. So that's going to be determined at a little bit later date, which I'll get into. So this does have an order of events and a prioritization in terms of how we can spend this money. What we have to do with this program is first address, fix, rectify, remediate, eliminate every unserved location in the state. So all of those locations we saw on David's map, those right now just under 8,000, we need to fix every one of those with this money. Once we've shown that we've done that, or our plan shows we can do that, then we have to remediate every underserved location, those lacking access to 100 by 20. And then finally, we can go to spending money to make sure those community anchor institutions are all served by 1 gig by 1 gig. So the interesting thing about this program, though, as David mentioned, is once we've done these things, and in conjunction with point number 3, we can spend money on adoption activities. So to expand, to drive up that broadband adoption rate that we saw earlier. So on the right-hand side, you see some of the specifics of this program. It will also be a competitive grant from the state to subgrantees. So we'll be developing an application and scoring matrix for this program. There is a match required on the federal level of at least 25%. And on some of the program priorities, you get a little stronger from recommendations in the Treasury ARPA CPF program to requirements over here. And with fiber projects definitely having a precedence with the federal guidelines, stronger participation by those alternative service provider arrangements, and some other components that you see here, as well as others in the notice of funding opportunity. So 2 milestones that are already in play in the box here on back on the lower left we did apply for and we received approval for $4.5 million of initial planning funds, which gets us to developing what's called a 5-year action plan, which really articulates how we're going to approach the program. So that is due in August of 2023. Let's go to the next slide, David, if we could. So then with this program, there's really 2 key dates, 2 milestones that are going to drive when the money hits the streets, figuratively and literally. So right now, as David mentioned, mapping is a huge component of this program. On June 30th, right now, the NTIA is slated to release our notice of initial funding amounts. So that's the base 100 million plus any more out of the 42.5 billion we might potentially get. That triggers a start date for this initial proposal, which is down on the lower middle. We have 6 months to complete that after that notice of initial funding amounts. So that puts us right to the end of the year, end of 2023. Assuming we submit that, which we fully expect to on time, the NTA approves that in, let's say, hopefully early 2024, we'll kick off our program and we'd likely see projects getting kicked off sometime probably mid to late, more like late 2024, and funding flowing accordingly. The approval of that, the initial proposal then also kicks off a 1-year deadline for us to complete the final proposal. So once that is submitted and approved, we get access to the remaining 80%. And if I didn't say that, the initial proposal approval of that gets us access to 20% of our funds, and then the final proposal gets us access to the remaining 80%. So assuming that final proposal is submitted and approved by NTIA sometime in early 2025, then we would expect to have projects kicking off and approved and money flowing from that, probably again late 2025, early 2026. So these are timelines, at least right now, as currently stated by the NTIA. They are subject to change by the NTIA and or the state as applicable. So with that, if there's any questions, again, feel free to reach out to me afterwards. And with that, I'll turn it back over.
That's it from us, if anybody has any questions.
Well, just one quick comment, Kevin. I appreciate your accessibility. This is Henry Todd, first selectman of the town of Canaan. I appreciate all the work that you're doing, even though it's going to take a lot of time.
Thank you. And on the point of accessibility, thanks for bringing that up. We will be posting, first of all, as we roll out and get ready to roll out the CPF program and this one, we will be proactively communicating to you. You can also keep an eye on DEEP's website. We'll be posting the funding opportunities there. They're not posted yet because the programs are not active, or we're not actively submitting solicitations right now or proposals, but feel free to reach out to me at any time. We want to make sure everyone is fully aware, fully vested, and fully partnering with us. We want these programs to be successful, so we're committed to doing all we can to give you all the information you need and enable the state to meet that goal of universal access. So thanks for that, and let us know how we can do better, and we're committed to making this work for you.
Thank you. Any other questions? Okay, I guess.
Thank you
let's
so
move
much.
on to Casey.
Thank you. Before I begin, I just want to quickly introduce Kevin Tedesco. He is the supervisor of the Intergovernmental Affairs Unit at CONDOT, and his unit is extremely helpful in being a liaison between us and the DOT. So thank you for being here.
Glad to be here.
Also, I wanted to be able to bring to your attention an attachment B in your agenda packet. There are a list of projects, Holbrook, Norfolk, Warren, Washington, and Winchester, that are actually being proposed by the DOT for your review into their 2023-2027 draft capital plan. If there is concurrence about these projects moving forward, then these projects will be incorporated in the upcoming 2023 statewide transportation improvement plan. Also, we are looking in the process of scheduling a regional LOTSIP meeting with Haley Ward, formerly Menard, And with the 5 qualifying towns, and I'm hoping to do that during the month of January, very shortly, once we formally get everybody's schedule. We are looking to reestablish the Northwest Hills Recycling Advisory Committee. Took the liberty of comparing the previous list of committee members against the municipal recycling coordinators list on the DEP website. And it appears in some cases that the former first selectmen were members of the committee, so I'm working with Selectman Rand to formulate an updated list. However, if your town designee or yourself would like to participate, just let us know.
Yeah, and if I could just jump in real quick, as I understand, the RAC hasn't met since before the pandemic. I think the pandemic just kind of, and we're in the midst of a current contract with Household Hazardous Waste Days. So that's, I think, the reason why they haven't really met, but we need to kind of, it's been so long now, we need to kind of reconstitute that, and we need to hold it. I don't want to steal your thunder, so go ahead.
Well, as Rob mentioned, we did put out the RFP for the list of vendors that is listed on the DEP website. Care Environmental Corps, Clean Harbors, MXI, and Tradeby Environmental Services. So we need to get back. They have a due date of January 27th to get back their proposals to us, and we're looking for some of the February possible. Also, we are going to be hosting a roadway supervisors meeting on Wednesday, January 25th, to discuss public works equipment cooperative, which will include the updated list of equipment, as well as our regions for our region, as well as the rental rates for the 2023 season. So that's it for me. I'll try to make it quick. Unless you have any questions.
Okay. Our next thing on the agenda is Mike. You're on for the legislature.
Fun times. I want to thank Emily and Rob and the committee for helping put together this season's priority list. Been busy since November, putting things together, gathering information. We decided to present them a little differently this year. We always talk about the issues, but we never really give recommendations on how to fix the issues. And every time you go down and testify, they want to know what your recommendations are. So we figured it was important to at least highlight and start that conversation with them, so that they can look at the issue and say, okay, well, how are they recommending to fix this? And then if they wanted more information on that, we could elaborate while we testify or in our written testimonies to those legislators. So hopefully you all got the list. We tried to thin it down. It's actually a lot thinner than it was. I think we had like 5 pages at one time. And we thinned it down even a little bit more to try to keep it as close as possible to what we needed.
For those that are on hybrid right now, we are actually going to pull up the list and share the screen as soon as we get it. Sorry, man.
No, it's okay. The one that we were looking at was that we still see highlighted down below under education was the enact that would enable towns and municipal school districts to adopt the 3 to 5 year rolling average for municipal assessments to minimize the fiscal impacts on any one given year. We were looking for specific input from COG members to see if that's something we want to keep on there or take off, and what were the reasons why. Because there was kind of conflicting thoughts going back and forth as it pertained to town-owned schools versus regional school districts, and how that would work in years that you would end up paying more. Does that mean your number stays higher for 3 to 5 years? Or is it actually going to flatten it so you don't have those peaks and valleys that you typically do when that enrollment shifts between the 2 schools? Or 3 schools, however many schools are in your region. So that was one of our sticking points that the committee decided, listen, let's bring this back to the full board and see if anyone wants that on, off, and if you do, what are your thoughts about it?
Mike, wouldn't you still keep track of what it would have been and at the end of the period reconcile it?
Correct,
Right,
correct.
so you're gonna pay it one way or the other, but just for budgeting, it's gonna,
Right, it'll flatten the peaks and valleys.
right, that one year, I'm saying year 5 might be interesting, but
So again, then you're gonna have a sharp sway. So you're getting
once
it,
every 5 years.
you may not have a sharp sway. The true up is the problem, right? Everybody pays in regional school districts based on how many students, children, whatever you want to talk about, are in the district for that year, based on data that says. How you do the true up is the question, and that's not widely held, that thought process. You start throwing this out here, you start getting into averages. Litchfield may be the one who's paying more to help other people not have the big increase. And how do you sell that to your residents? Because the most honest way to do it is just be responsible for your students that you have. And accept that responsibility, which we all cherish, educating our children and giving them the best we can. But it left to their own devices, we could all be put in a position of saying, hey, let's just do averages. Averages. So Litchfield or New Hartford or Harwinton or anybody else who has that may be the one, because there's nothing written. You're kind of assuming that it's gonna be that way,
No, I'm not
but
saying-
nobody really
I'm not
knows.
talking about averages. I'm saying keep the actuals, but don't budget in those 5 years, but at the end of the 5 years.
So am I gonna get
reconcile.
interest on my extra payment for 5 years?
Well, that's my.
Am I gonna get? And what am I?
I'm gonna write that in.
What am I to forgo in capital or operations? Because we all know how this game is played. The general government's gonna eat it while we pay more for education on a regional school district. I'm a hard no, because nobody's really been able to give me to adequately describe how the legislation will be written. And if you let the people at the state do it, it just won't work.
I'm kind of on your side on this one. I think it's an extremely difficult issue. On the other hand, when you have those spikes.
You got 'em.
Yeah,
You got
and they're troublesome, but you gotta live with it, just like every other town
Right.
that district does. I find it. I just am suspicious of the state government coming to I'm sorry, I think this is a bridge too far. I really do. And I would like to keep the state out of it if I possibly could.
Just an example, North Caney got hit last year with a $750,000 increase in our education budget at the high school with 106 students. And it killed the hell out of our budget.
So you would be for this, you're saying?
Well, I know next year's not as gonna be as high. I know Cornwall's gonna be going up. Out of 300 students that go to Housatonic, North Canyon sends 106. We pay 48% of the Region 1 school budget for the other towns. So we get hurt real bad. And the number of students of other towns that go to the high school, just for instance, Salisbury, 66 kids. And they have more students in their K through 8 than North Canaan has. And unfortunately, Kent, Sharon, they got private schools and that's where the kids go. So we get hit real bad.
So is it basically the kids that go to your school or the kids that are in your school?
No, the kids that go to the Housatonic.
Go to the school.
Right.
Yeah, we got hit for $400,000 one year. I mean, for a town's budget is.
Tom's not saying words.
Yeah, I mean, it was
good for him last
8%.
year.
It was 8% increase.
Yeah, I'm not sure. It's not regional.
It'll happen. It will happen, and sometimes it will happen for the oddest reasons. Your school population could in theory stay the same. And yet your proportional piece of the pie by subtraction in other communities could go down, and therefore you become a larger proportional piece of the puzzle. You're better, in my mind, thinking of dealing and negotiating with your regional board of ed and say, maybe this is so good that maybe there should be some consideration of how you're budgeting as opposed to billing. Because here we have Northwestern Regional 7, and sad to say, being announced for retirement today, who's been a wonderful superintendent. She's been a very, very good budgeter and administrator. And sometimes there are just years you gotta pay, and there are costs associated with doing the business. And it's kind of tough going into the business because unless you can go back in time and make more children be born in Colebrook or Norfolk or Barkansas or whatever it is to kind of eat them up. It is what it is. You gotta do it, but nobody's been able to say with certainty how it would be adjusted and how we would get paid back. And until that happens, I'm out. Because it's pretty hard to go to your town meeting and say, oh,
I'm on COG. Is there any chance you could get me how much we got in ECS? Yeah. Approximately. Yeah.
So, yeah.
They're bitching about Salisbury has all this, Thing, you know,
Yeah,
so
I gotta, someone, so they just please make sure you're muted.
it's easier for them to pay for insurance, for education.
I got
So what I will say is that the whole, since November, all the conversations and even the 3 or 4 legislative meetings I had last week and the ones we've had this week, the theme has been the big push is gonna be talking about ECS, excess cost grant for the special education, and then middle class tax cuts, affordable housing, and energy. Those are gonna be the big pushes, but don't sit back on your haunches and think that that's all they're gonna talk about. Those are gonna be your shiny objects that they're gonna get everyone riled up for while they slip all the other stuff underneath the radar. And so we'll keep an eye on all of that for us. With this particular recommendation, if it's appropriate through the chair, maybe we should call a vote on that one recommendation to either have it or remove it. And then we can vote on the whole legislative platform or comments on the rest of the legislative platform.
I'll make that
Okay,
motion.
But before you do make that motion, if it were to go forward, similar to what we dealt with in the last legislative session where they tried to do some adjustments to local zoning. If this goes forward, there should be a proviso for an opt-out.
Yeah.
Individually, so that it's an enabling thing that if you want to do it for your district, fine. But don't do the one size fits all on everybody, because some boards may say, no. You know, region 7 or region 10 or region 1 or whatever it is, region 22, is it?
One, it will be, we're not there yet.
Okay, but they may say, no, we're
I
fine.
think everybody's missing the point. This says would enable a district to adopt it. Doesn't say that. It says that each district could look at it and evaluate whether it makes sense for their
So we
district.
already have them, it's already talked
But it
about.
doesn't say that you have to do this. So when you say opt out, then you're not opting out. You take your school board down,
I understand.
who decide what to do, whether they think it makes sense for them. Just, it doesn't force you to do anything.
I
If
understand that.
if it goes through, we can propose specifically, as I said, and provide an opt-out for towns that not willing to, and district not willing to participate if you wanted that, then.
My experience is that when you bring these type of issues to the table at the state level, they tend to take on a life of their own. And you may have your vision of how it works, but you get people in Hartford talking about it, and you be careful because you may not get what you want. So the more you talk about it, the more you open the door to the uncertainty of what they choose to do. And let's all face the facts. Our little corner of the state here isn't well represented in terms of numbers of representatives and proportion of how things settle out in Hartford. So you bring this on the table, you may not get what you want. So again, if you want to call the vote,
Well, we should call the vote on that one recommendation, whether to keep it in or not. So it's either yes to keep it in or no to keep it out.
Do I have a second to the motion? I made a motion.
I'll second it, Don.
Okay, all those in favor of opting in? Of keeping the recommendation. Keeping the recommendation.
Just clarify the recommendation.
The recommendation would be the one that's listed here with the sentence of allowing towns or districts to opt out.
We're saying to remove that recommendation.
so the motion's been made to keep this in, and it's been seconded, and it's a call has been asked for who supports it.
Oh, I'm sorry.
Yes.
I thought you were moving to remove the recommendation, Don.
No, I was moving.
Okay, so
to
I'm
keep
not,
it in as
we're on
worded.
my second.
I was moving to keep it in as worded.
So Don made a motion to have it in as worded. Do we have a second to that motion?
Denise, did you second it or did you?
No, I was recommending to remove it.
Okay.
Okay. So we have no second to the motion.
I'll make a motion to remove.
Second. Motion's been made and seconded to remove it from the legislative priorities list. All those in favor?
Aye.
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 It's out.
Assuming from looking around the room and listening that it passed.
We're taking
There's
it,
one
It's
there.
out.
we're
One no.
taking it out, yeah.
Okay, so now what we need to do is if anyone has any other questions or thinks anything else should be removed out of this, please let us know. If not, then it would be appropriate to entertain a motion to accept these legislative priorities list as our final list for this season.
Do I have a motion to that effect?
Can we talk about the 830G recommendation? Weren't we gonna bring that in front of everybody? Where's that one at? The housing part?
Sure, what would you like to talk about? What was your question?
So my thought is to remove any mention of the 830G, just to keep it the way it is. I don't think this has been a problem for our towns that I've heard of. And if anything, it's been an incentive to get affordable housing and housing options at all. I think, as we've heard repeatedly, there's housing is playing out now that there's so little, it's impacting our workforce. The housing is becoming increasingly scarce, and I don't think this has been a problem for any towns that I've heard of. We'd like to have more affordable housing, at least in our town, than we have now. And I wouldn't like to see us go back. So I'd make a motion to delete this just for discussion. And again, with the more we talk about it, who knows where it goes, but I don't think it's been a problem. So I wouldn't address something that's not been a problem.
Well, I can say that 830G, as discussed in multiple legislative meetings currently, and not formalized yet, that if towns do not comply, their discretionary funding will be removed. So that's the stick and carrot.
And Mike, this is Curtis. Is this a recommendation to get rid of 830G, or is it to change the 10% down to 4 to 5, or both?
It's to change the flexibility from the 10% down to the 4 to 5%, which is more attainable. And even recommended by the Blue Ribbon Committee back in the 90s by both the legislators and municipal leaders, that 4 to 5% is a more attainable level, because many of these small towns have large watershed areas, some to the tune of 80% of their land is watershed. So it'd be impossible for those towns to hit that 10%. And if they're gonna start enacting discretionary fund removal, and using that stick and carrot, that's not fair to those other communities that cannot reach that 10%. And don't have.
Mike, if I may add, we went through our housing plan, and what I don't like is that the definition of affordable housing is dictated by the state. So they tried to say we had 2% affordable housing in the town of Burlington. I went through the tax rolls. We have 60-70% affordable housing. It's just that because it's not a state run or federally run program, they can't verify that people that have affordable income can take that housing, that it doesn't count as affordable housing. So I'm not really a big fan of the way that 830G and the states twist the definitions to their benefit and our detriment.
Yeah, because the way they clarify is a deed restricted property. And if it's not a deed restricted property, it's considered not affordable housing. If it's deed restricted, it means that even if it's sold, whatever, no matter who lives there, it's always going to be an affordable housing unit. And that's why the state defines that as a deed restricted. Now, if a person wants to put a deed restriction on their property, they can go through the process to do that and qualify it as affordable housing in Section 8. And it's not very difficult to do. But you just have to get state inspections and all that good stuff. But as far as changing the definition, I think that's a much larger conversation with the legislators to see if we want to open that definition up or create a new definition, but I doubt there's going to be much movement on that, but I understand your point.
Yeah, so I guess my point would be that if we could soften that 830G in any way, I would be in favor of it, just because of the way that they have things defined makes it more difficult for even our housing plan. And I like what you have here: support local housing plans as submitted. We focus more on private development. They tried to steer us towards subsidized housing and so on. And our housing plan, I think, is a good plan that focuses more on affordable housing across the spectrum, and but driven mainly by private development.
And that's what this recommendation was meant to do, was to soften 830G, or at least have them look at it and consider softening 830G.
I would comment that, if anyone in this room is of the mind that 8-30G will somehow be, removed, they are not realistic. But, from our perspective, and in many Litchfield County towns, a third of our town between state forest and MDC land will never be developed. And our affordable housing plan and submission would show 3.5%. Of our homes in New Hartford are designated as affordable. So this would give us a goal still to aspire to, but it's a more realistic goal, right? So it doesn't mean that New Hartford is off the hook. It's just something that we might actually be able to get to that's real. 10% is not real. It will never happen. And when you review the state affordable housing list, really the vast majority of the towns and cities that do meet the criteria, the only way they meet it is through massive amounts of state, federal, or local subsidy taxation. So if you want a goal that's real and a recommendation that might actually get a look, I think the 4 to 5% is something that they might actually say, hey, that's actually not bad. It's not unreasonable in the fact of thinking that somehow they're going to vote to rescind 8-30G, but for towns in that smaller population that can prove and make the case that they have massive amounts. And we all know Litchfield County in the corner, gosh, there's so much preserved land out there that the state has supported and pushed these conservation efforts. That makes it harder and harder and harder. And there's not a lot of areas of these things that have access to public water and or public sewer. So the true cost of actually trying to implement this is not just the subsidy of building these developments, it's getting the public utilities there. So I would say, even though New Hartford still has 3.5% and 5% would be a goal, I would support this initiative left in.
Yeah, I think in reference to what I said, Salisbury's never going to get to 10%. And I bet quite a few of us won't. At the rate that I see it. So I'd be happy to support lowering it. But I think 830G, the concept of allowing some more flexible development on a case-by-case basis, and there are some checks and balances in that, the way I've read it. But anyway, I'm happy to see it go down to 4 or 5%.
But the short story here is to be realistic. We as a small rural cog are never going to really change 830G. There's too much political activity in that regard throughout the cities, throughout the state. So all we can do is try to make it more achievable by our towns, our region. So I think the goal here is to do that, is to make it more flexible, lower the threshold so that the small towns might actually be able to achieve it. I think that's the bottom line. We're not going to affect 830G as a cog or as a region. That's way out of our reach.
But there was a glimmer of hope in that Speaker Ritter yesterday said that he thought that the solution was somewhere in between. Supported the concept of the dictum that it must stand at 10% and we must do this in every town, or there's penalties. Because there's a recognition that some towns just can't make it. Try as you might.
So we ought to take advantage of that.
So, agreed.
I agree with that. The simple fact of the matter is a town like Falls Village, where 80% of its land is not suitable for building, either under conservation, farm, state ownership, or federal ownership.
Right.
I won't even okay a conservation request in our town because there's no place to build.
Right.
There's no room to grow, and finding a place to put affordable homes in our area is exceedingly difficult because we have no sewers and issues like that. I would actually be very much in favor of this. I think it's a very reasonable thing. 5% we might be able to get to. 10% we will never reach in our town. It will never happen.
But to think, the thought process and the recognition is such that the state is complicit in preventing us getting there because they're approving every conservation request, which I support. We have tons of preserved land in New Hartford too. But every time you take off a piece of land, some of them are the most developable piece of land within your community, and you say, well, what's left? You know, they want to have these pristine preserves, and DEP.
That's why our
is
board won't
conserving
approve
these.
any of them.
Farmland preservation grants, it happens. We're here at these meetings and we're all giving positive referrals, supporting land trusts and different acquisitions. And every time we do that, we make it harder to develop our smaller communities. And that's the character of our communities that we want to support in Litchfield County. We want these open spaces, and people come to these locations because it's the quality of life that they want.
That's not gonna change in our town.
I think also that, you know, I view it slightly differently that, I am working with, Jocelyn and Maria Horn on trying to get a dialogue with the state to see, because state just bought another over 500 acres in Cornwall. They own over 6,000 acres. We've asked them for a little bit of land for housing. There hasn't been a dialogue. We're gonna try to get a dialogue going. That's gonna take some time. But while we're talking and things, I know the average house price in Cornwall went up 50% last year to over $800,000. And that, while we haven't brought any affordable housing online for 5 years, we did a senior housing for 10 apartments on 1 acre. We didn't require well or sewer. 1 acre, 10 units, it's worked out well. And just at $800,000, we're pricing out our young people, our old people. The ability for local people to compete in that market doesn't exist. There's no rental housing. It's been sucked up by Airbnb. So I think the reality is we're going to need to be creative, work with the state on getting some rental units. At least that's what we're going to try to do. Because I read the census, Litchfield County lost population in the 2020 census. Cornwall increased, Salisbury increased, but most towns lost population. And I just see us, you know, we're in a very difficult situation here. And I haven't seen this being a problem in our area. And we need a partnership probably with the state and private developers to bring on more rental units, or else we're going to go back to where we were and just keep on losing population. So I'm not a fan of all state activities, but that's just where I'm coming from.
So the motion we heard from Gordon was to remove the recommendation.
Correct. There's a second to that motion. Hearing none, it's moved. So, any other issues with this? Then I guess by rule, that would be, we were accepting all the rest of the recommendations made by you.
I'd make the motion to adopt the legislative platform as revised to the removal of the 3 to 5 year hold.
Is there a second to that motion?
I'll second it.
Second. All those in favor?
Aye.
Before we move on from that thing, I did take the opportunity to talk to Betsy Guerra at Cost, and obviously the ECS funding is of supreme importance, I believe, in this legislative session. And I've offered to her, I have a spreadsheet that I've developed that I would like to track all the towns in the Litchfield COG and provide her with the data of what your education cost is versus what amount of state aid ECS you get, and what has happened over the last 10 years. It's all readily available in your audits. So if somebody in your offices could take the time to scan a PDF of that audit page of your revenue and the expense page of your, whether you're a regional school district or you kind of New Hartford, we straddle, we have 2 education budgets. But if you could take the time to do that, I would be happy to provide a comprehensive spreadsheet for everybody so that we could show the state what has happened to the level of support of education funding in our COGS towns for the last 10 years.
Did you have a microscope? Just so that you can see ours.
And you know, it's funny you say that, because in the legislative priorities where it says, you know, to increase ECS funding, I contemplated the thought process that statement should be modified to include a minimum disbursement per child in every town. Because at some point, there are some of our communities that get next to nothing. And I just
And
feel
we're
like
one
the
of
formula is unjust, and they are leaving many school districts
It's
behind.
a third of 1% of
Mhm.
our educational budget in our town.
So we all know over the last 10 years, and I would challenge, I know exactly what it is in my town, but our increase in education spend over the last 10, 11 years is 30%. And the decrease is 6% in ECS. So when you used to get, 21% of ECS and to offset that total cost to try to provide it, it gets harder and harder and harder. And what's the answer? It's the regressive real estate taxes that we all talk about, that everybody complains in Hartford about, but they never make the substantial changes necessary to solve the problem, right? So if we show them data, will it help? I don't know. But at least we can do is put our best foot forward and try, and I'm willing to do it. I already have kind of the spreadsheet set up, and if everybody gives me their data, has, somebody in their office send me a PDF of those things, I'm happy to do it for you. It's not.
All right. John Field. Are you available?
And it's gonna get worse under the.
Looking on the, I don't think he's on the, I don't know, he may have been there, but he's not there anymore, which is good. We're running out of time anyway.
Yeah, we're running a little along. I suggest that we drop the municipal forum.
So moved.
Unless
I do it over lunch. Anybody wants to talk on it?
So can we move on to administrative items? And I think that we have one comment that I would like to make. I think that we need to get some more participation from members on the broadband issue that's happening in our area. And I was wondering if anybody might contact me at a later date that their willingness to participate in broadband discussions. I think that this has got to be led by the COG, and I think it has to be a more diverse group than Don and I.
Sign me up. I've wanted to be involved with the subgroup. Absolutely reach out.
Henry, this is Curtis. Can I just say one thing?
Yes.
I don't want to get into a whole municipal thing, but I'm very curious about, and we don't need to talk about it, but this new land use training for zoning administrators, it's like, I don't know where it came from, but for our ZBA and zoning members to have to take 8 hours of coursework, sometimes on a weekend, seems fairly onerous. And the other thing that's weird about it, I think that you have to have it by January. Well, what about if somebody's running for office and the elections are in November? Do they have to rush into this training? And it's just, I don't think it was written. I don't understand it, but that's all I have to say. Sorry.
I agreed. We're going through a training program on our planning board during the meetings. Our P and Z. I don't know if the zoning board of appeals is doing it. But you're right, it's an onerous thing. But it's the law, I guess. What more can I say? Can we move on to the administrative item?
Makes a motion to approve the meeting minutes for November 8th.
A second?
Aye.
All those in favor?
Aye.
Approval of the financial statements?
Once it's December 8th,
What?
It says November 8th.
November 8th. Oh, how did that get through?
Okay,
So I'll amend my motion to December 8th.
Right.
Or whatever one you guys feel is appropriate.
I will second that.
And all future minutes.
Yeah, all.
Okay.
I'll abstain,
Aye.
abstain.
Doug Thompson abstained.
And we have is it December or November that we're approving the,
November.
yeah, okay, that is November. All right. So approval of the financial statement for November.
Second.
All those in favor?
Aye.
And did I skip one?
No, the addition, the agenda,
Oh,
there's a document right next to you. It's for the Houstonic River Commission.
oh,
I make a
Yeah.
motion, no other items be added.
this is a very simple thing that, we're getting the partnership of the Wild and Scenic Rivers Program for the Housatonic River. So, the Housatonic, River Commission has asked that the COG serve as fiduciary for the funds that are gonna be delivered. And it will give more revenue to the COG and, with, I don't think, an onerous amount of work.
Yeah, they need a fiscal agent to be able to accept the federal funds that would go through this for the
First, we need a
designation.
motion to add that to the agenda.
All those in favor?
Aye.
Oh. Let's finish discussion.
Yeah, thank you. Yeah, they were just designated a portion of the Houstonic River passing through the region, specifically the 7 towns with Houstonic River Commission that make up the Houstonic River Commission is now been as part of the omnibus bill, federal omnibus bill. The wild has been deemed wild and scenic, so that's a great thing. I don't know if anybody was aware of that. But with that comes the ability to obtain federal funds for basically the management, water, the river management and other activities that go on. In concert with the designation as wild and scenic. Houstonic River Commission met Tuesday night. I was there and they did make a motion to resolve that the Houstonic River Commission appoints the Northwest Council of Governments to act as the HRC's fiscal agent for purposes of accepting and expending federal funds appropriated to HRC under the Partnership Wild and Scenic Rivers Program of the National Park Service under the Wild and Scenic Rivers Act.
I'll make that same motion.
Second. All those in favor?
Aye.
I eliminated discussion on purpose. Is there a motion to adjourn the meeting?
I have one question.
Yes.
Have any of the towns participated or had a Connecticut military cybersecurity assessment conducted?
Yes.
Participating?
And we're having,
So you're talking about the election.
We're having one
security
coming
one,
up.
they want to do
Not
this.
the election security,
The IT.
the IT. That's okay.
So for the record, there are two different
There's
types.
2 different types,
There's one
right?
election security and then there is one internal cybersecurity.
Right.
And I've done both. And if you don't do them, you're free. Hey, it's free. They're really good. They'll go through your whole thing. But there's
Yeah,
a route.
fantastic process.
Yes.
It really is.
They'll tell you where your weakness.
it's worth every minute of your time that you're gonna spend on it. You will appreciate it.
Yeah, it's really important because they like to target those who are least prepared.
That's right.
And hardened. And I believe some of this may be a part of the deliverable of the Demis Region 5 grant, Homeland Security Grant Program, so we really need to work on that. And I did send you all, as part of this agenda package, the contact to the Army Guard.
Yeah.
Right, that's the right contact, yeah. Let me know if you need any more information on that.
Good. We're most on the fourth with her.
Second.
All in favor?
Aye.
It's 5 minutes.
Well, you run a pretty tight meeting there, Henry. All right, we're adjourned.
Thank you, everybody, for joining in remote.
Yeah.
I never had.
I'll step down.